Hey guys, so since everybody is wondering why, asking questions about, etc., I figured I would easily just make a video, answer everybody's questions, general questions, all that stuff, because it's a lot easier than having to get back to everyone personally because I have a lot going on. So I posted earlier this week about my appointment with the surgeons at Anne Arundel, and we've decided to move ahead with the prophylactic double mastectomy. So what is that? It is a surgery to prevent cancer, in my case, and removing all of the breast tissue and all of that jazz. Basically, it's different for everybody. Obviously, everybody has different body, different, all that stuff. But I went in on Monday and had all of my scans done and met with the surgeon and all of that. My scans came back pretty clear, so that is a good thing. I have what is considered fibrocystic breast tissue, so it is slightly different than just like normal breast tissue. So it is a little bit harder to detect differences in texture and feelings and different symptoms, I guess, and like scans are a little bit different, I suppose. So, the doctor read the scans and she said it was pretty clear for her. She could tell which tissue was, what, and it seemed pretty clear, but of course they won't know anything until they test everything and all of that. But so far on the side of non-cancerous. Back in March, I had an appointment to set up my risk prevention program, which basically is a program that assesses your risk of breast cancer or ovarian cancer, depending on what you go for. And I'm sure there's other cancers they have programs for. Just this specific one is, female anatomy. So I met with a nurse practitioner and we went over everything, get all of your medical history, your family's medical history, all the things, and go over options. And back in March, she said, we'll have to bring your case to the board. I was not of the age requirement to actually be a part of the program. You have to be 21 in order to be in this program. They were able to accept me under my circumstances, which was great. The board, however, ruled that they were not necessarily comfortable with sending me forward to have surgery. So, and actually my doctor was on the board and she said that it primarily had to come down to whether or not they wanted to introduce me to all of the testing and having to do all of the tests every couple of months and the risks involved in the radiation and, being in a testing environment, having to go to the hospital, for an entire day to get all these tests done and then worrying about the test and then, all of these things that are involved in that, and versus, doing the surgery. And being as young as I am, that would have put me at, 20 plus years of these tests until something came up positive, or I reached an age they were more comfortable with doing surgery. She said that most patients in their early 20s are pushing to do the surgery for a lot of different reasons than mine, and she does not feel necessarily comfortable with those. However, after speaking with me on Monday, she's a lot more confident in my ability to make those choices, having to do with the fact that I've had a lot of other health issues, a lot of other health risks, and the point in my life right now, it is more logical to have the surgery done now versus in a few years, especially since their recommendation was to do it in 3 years. So that would put me at age 23 and like right over their age limit or requirement. But that would also put me at just when I'm graduating out of college, as long as I go along with my program and, you know, settling into a career and, you know, all of that. And it just didn't make sense for me to wait that long and go through all these tests and worry about that, and getting closer to an age that my family had to endure cancer. So it ultimately was my choice. I, of course, can deny the surgery and decide to do the testing every couple months. But financially and physically and probably mentally more prepared to do it now than I would be in 3 years, especially with college and my career and all of those things. So that was kind of the decision why. I have a very strong history of cancer in my family, and with my own medical problems that I have, I'm a much higher risk patient, along with, you know, a lot of unknowns, and the type of tissue I have in my breast and in the way that they are developed. I'm not going to go into details because describing my boobs is not going to help anybody. But the plan for right now is I have my endometriosis surgery coming up on the 4th of September. The following Monday, which is the 9th of September, Michael and I will be visiting 2 different plastic surgeon teams to decide on who we would prefer to be doing the surgery and doing, you know, all of the post-op work and the reconstruction, because I have opted to do reconstruction instead of going flat, which basically means instead of removing all of the breast tissue and just having a flat chest, I will be having implants done either during the surgery or after the surgery, depending on, you know, what the plastic surgeon team has to say about everything. So Michael and I will have that decision to make on the 9th. After the 9th, we will decide on who is going to do the surgery and then have their coordinator meet or call, I guess, call or email, I suppose, the coordinator of the breast surgeon to figure out when in their schedules they both are available to do the surgery. At which that point is when we'll have a date and also more appointments, because I'll have to do pre-op appointments. I have to meet with another surgeon for the surgery because they'll have 2 surgeons in there. And then also meet with their financial advisors and make sure insurance is all correct and able to cover everything. So it's a lot more work that has to go in, but it's estimated before November that the surgery will be happening. I'm hoping it's close to the endometriosis surgery as possible, so then the work isn't all as choppy and it would make more sense. Especially with like the kind of work I do. So it is coming up real quick on us. It was kind of a decision I was thinking I was going to have a little bit more time on, but I didn't really have to fight my surgeon about it, so it was kind of better off that way. Recovery is still kind of up in the air. It's My breast surgeon says that the plastics will give me a little bit better time frame, but she estimates it will be at least a month, if not 8 weeks. So 6 to 8 weeks is kind of the estimated time she was giving me. So a month and a half to 2 months. Because of the type of work I do with animals and kids, I cannot go back to work when I get cleared for light duty. So when I get cleared for light duty, I still can't handle kids, can't pick them up, can't walk dogs, can't have dogs jumping on me, those sort of things. So it's probably going to be a good amount of time out of work, which is sucky. But we'll figure it out, I guess. It also depends on whether or not they decide to do expanders, which is basically a device they put in during the removal of the breast tissue to expand the skin and tissue that they leave to have room for implants. I am hoping I will not need expanders, especially with the amount of skin I already have. I'm pretty sure implants will be fine in there, but of course that's not something I get to really fight on. So they will also be putting the implants in over the muscle instead of under the muscle, which helps with healing because my muscles won't have to stretch, especially with my scoliosis. My muscles don't really line up the way other people's do. So it works out a little bit better that way. It's going to be extremely difficult for me to handle our dogs, so we are still trying to figure out the best way to go about doing that. Of course, I want my dogs around me when I'm recovering. I want to, have lazy couch days with them and everything, but with the nature of the surgeries, I can't have them jumping on me and laying on me, which is something we normally do. We, play a lot, and they sleep in the bed with me and all of that sort of thing. So it's going to be a big adjustment, one that will probably not be an easy transition for them or myself, really. Another thing is Michael is probably going to need more help than I will. I've done, all the surgeries. Like, I've had surgery every year for the past 5 years. So, it's a different type of surgery, sure, but it is still surgery nonetheless. It is going to be a little different having upper body surgery rather than lower body surgery, but it's more about just rest and healing and stretching and things like that, and just making sure I don't overdo things and keeping up with the pain management and all of that. Whereas Michael now has to take over our entire household, which he is not used to by any means. So pray for him. And please, for the love of all things holy, please be patient with me and Michael, because it is extremely hard to talk to everybody. We do have a very large family and a good amount of friends, which is wonderful, but it is very hard to get back to everybody, especially with everything going on. It's not the top of our priority list, which sounds really terrible, but we love you guys, but there's a whole lot of stuff that has to happen in our house and with our appointments and things like that we have to figure out before we can just, I guess, talk to everybody and get everything kind of set up. And I really do appreciate everybody reaching out. It is wonderful. I don't want that to come off the wrong way, but it is very overwhelming, along with the fact that I am trying to work as much as possible before the surgery, and I am so burnt out, and I still have a week and a half left of really, really, really long days. So just be patient. I'm also really, 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 really terrible when I'm in pain. Like, I'm not as easily able to deal with situations and people and feelings and emotions and things like that. I have a very short fuse, which, you know, I'm not having these surgeries because I'm just fine. So we'll just say I'm a bitch. So just please be patient and consider everything we are going through on our end. And please stop saying you're sorry for us or for me or for, you know, whatever. It is what it is. I'm not. I mean, it sucks, but please don't be sorry. Like, it's something that we have to go through, and it just is. Like, it is life. It's just like, you know, fixing a flat tire. Wow, that's a really bad analogy. You know, it's just one of those things you have to deal with in life that there's no way to go around it. You just change the tire. So, there's nothing really to be sorry about. I mean, yes, I'm losing a physical part of my body and taking off work and school and the financial stress. Sure, great. It's a grand old time, but please don't be sorry. I'm a very stubborn person who does not like pity. And just like a few things to just not say to patients in general, for just like a public service announcement. Please stop telling me I'm young. I know how old I am. I know how long I've been on the planet. So I do not, under any circumstances, need somebody to be like, oh my God, you're just so young. Like, yeah, I know. Thank you. Thank you. I would like to live a little bit longer. This is why I'm doing this. So, I even had a assistant at the doctor's office say that. Just like, it might sound fine in your head, but like, it doesn't come across that way. Like, it just doesn't. And please don't just tell me I'm getting a free boob job, because that's not what this is. It's not free. It's not even a boob job. It's really painful. Like, we're not just doing like implant, like that's just not what this is. So please don't say that, especially because it's not free and it's not how this works. And it's just irritating. Just don't say that to anyone ever. Like, just don't say that. There are so many things. Just like, please be mindful of what you're actually saying. Like, some of the things that come out of people's mouths just surprise the hell out of me. And please, if you don't know anything about what you're talking about, don't speak. If you have questions, feel free to ask them. I am so down for questions, but don't go into a conversation assuming you know what you're talking about and have absolutely no idea. It is extremely frustrating. So just like, public service announcement, don't be rude. Like, just don't do that. So, I think that's everything. I've been talking for like 20 minutes about everything. And I plan on doing like a little video documentary styled thing through the whole process. So maybe it will help people understand a little bit more, especially from a younger person's perspective going through things, because there are not many people my age doing this. I believe I am the youngest patient at the Anne Arundel Medical Center doing this. I could be wrong on that, but I am pretty sure they did state that I was one of the youngest. So it's not easy. It's like, it is what it is, but it's definitely not easy to continue doing things that people my age aren't doing, in both a positive and a negative way. There are some great things that I'm doing that many people aren't doing at my age, but it also goes with all of the other things that I'm doing and the reason why I'm able to do those things and the maturity level that you have to have in order to do some of the things I do. So anyway, I'm rambling again. So I think we're all set on questions and things. So if you have any questions, please reach out to me. I will get back to you as soon as I can. Please don't anticipate me getting back to you right away. I am in the process of trying to figure out what is going to be best as far as like a meal train or a care plan or a calendar or, whatever way to communicate a little bit better on both ends, like to people to us and us to people, without losing things in Messenger on like Facebook or Twitter or social media or our cell phones, because it is a bit overwhelming. So we're trying to figure out the best way to do that, and if you have any suggestions, please let me know. But I think I'm all done talking. So have a good night, guys.